Hello, my name is Adrian Rodriguez, and today we'll be discussing using ethers as inhalation anesthetics. To start off, ethers are organic compounds that are composed of an oxygen atom connected to two R groups or substituents. These substituents can be alkyl groups. An alkyl group is a single bonded carbon and hydrogen atoms linked together in a chain of varying lengths. Halogenated ethers will be the focus of this presentation, which is a type of ether that replaces some or all of its hydrogen atoms with halogens in one or both of its substituents. One example is sevoflurane, where one of its substituents is a carbon bonded to two fluorine atoms and one hydrogen atom. The other substituent is a two carbon chain where both carbons are bonded to three fluorine atoms. One of the most popular uses for halogenated ethers is for anesthesia. Anesthesia is the use of medications to reduce the pain felt by the patient during surgeries or other procedures. Anesthesia can be applied in several ways, such as through injections, inhalation, or through a combination of both. Anesthesia works by inducing muscle relaxation, unconsciousness, or a loss of sensation. Anesthesia has some drawbacks, though, such as hyperthermia, nausea, vomiting, a drop in blood pressure, muscle rigidity, and metabolic imbalances. Depending on which anesthetic agents are being used. Through the use of monitoring devices, techniques, and generally safer anesthetics, these issues can be minimized, though this level of security was not always around. In history, other compounds were used as inhalation anesthetics, such as chloroform, ethers, or nitrous oxide, also known as laughing gas. These early anesthetics had high adverse effects, such as nausea, vomiting, lung damage, or irritation, suffocation while being under, and many more. This had led to the pursuit of finding more suitable alternatives, such as in the 1900s, the use of diethyl ethers became popular, but it still had many similar downsides to already pre-existing anesthetics. A diethyl ether is a simple ether that has two ethyl substituents, which is a two-carbon hydrogen chain connected to a center oxygen atom. It was not until the 1970s that halogenated ethers were introduced, such as enflurane, which would then later be replaced by newer and more efficient ethers. One of the most widely used anesthetics of our time is sevoflurane, which became available in the US to use in 1995. Modern inhalation anesthetics that are commonly used today are nitrous oxide, halothane, isoflurane, desflurane, and sevoflurane. These compounds were much safer as they were more potent, caused less irritation, and provided a quicker recovery time for the patients. However, these anesthetics still had downsides, such as a drop in blood pressure, irritation of the lungs for people with already pre-existing respiratory issues, and a decrease in the amount of blood being pumped by the heart. Some of these benefits are attributed to the addition of halogen atoms to the structure. The effects from the halogenation of these ethers, specifically looking at fluorination, are greater stability of the molecule, lower toxicity, as well as lowered solubility in blood and tissue. Lowering the Lowering the solubility in this case is beneficial as these anesthetics can cause damage to the liver, but not by on its own. Byproducts are created when these reagents react with certain enzymes in the liver, creating fluoroacetic acid, which damages the livers and kidneys. Thus, by reducing the solubility, it also reduces the chances of these anesthetics from entering the liver and causing these possible adverse effects from occurring. Most of these anesthetics are liquid at room temperature, so they must be vaporized and mixed with oxygen before they can be administered. The gas mixture is passed to the patient's system by reusing the exhaled gas to maintain a consistent concentration in the body, where it travels from the lungs and into the bloodstream. Inhalation anesthetics are also commonly used in combination with other IV anesthetic agents. Dosage of sevoflurane ranges from 1.4 to 3.3% in oxygen, where the higher percentages, being around 3%, are meant for newborns and children less than 3 years of age. The lower percentages of around 2% are meant for older adults, being around 30 to 40. And people of ages between 60 and 80 could be dosed around with 1.5%. These anesthetics cause their effects by modifying the nerve endings in the brain called synapses in some shape or form. When an electrical signal is sent from a cell, neurotransmitters are released from one end of the synaptic gap to the other until they reach and bind to a receptor, creating another electric signal in the synaptic cell. Neurotransmitters are small organic molecules that have varying roles and uses. The binding of these molecules to a receptor will trigger different processes depending on the signal, such as blocking or opening up a channel that releases certain hormones, or it could simply continue to relay a message. In the case of sevoflurane, its effects on inducing and maintaining anesthesia are generally unknown, but research suggests that there are at least 4 main ways. One of them being preventing the release of neurotransmitters from the synaptic cell, stopping the signal altogether. These inhalation agents could also block the binding sites of the neurotransmitters so that they are unable to transmit a message. They could also cause an electric signal to be released to release neurotransmitters, which would start a message. These anesthetics could also cause a retake of neurotransmitter back into the synaptic cell, thus removing the message. We'll be going over 2 receptors that are affected by these processes, starting with gamma aminobutyric acid receptors, or GABA for short, which is a type of chlorine atom. This receptor, when activated, it blocks the activity of the GABA alpha receptor by binding to it, which causes its chlorine channels to open. GABA alpha is in charge in mediating sedative effects from anesthetics or alcohol. So, by modifying the GABA receptors to prevent its activation, allows the GABA alpha receptor to remain closed, thus enhancing neuronal inhibition, or a decrease in neural activity. Another receptor that sevoflurane affects is the glutamate receptor, which is an excitatory neurotransmitter that excites neurons to fire off a signal to pass a message. These receptors help maintain memory, mood regulation, and cognition. Sevoflurane decreases the activity of these receptors by binding to and occupying its binding sites on a synaptic cell, thus blocking most or if not all neurotransmitters. This process aids in the effectiveness of the anesthetics. This marks the end of the presentation.